This is Doug Dimmadome, owner of the Dimsdale Dimmadome, and here's today's campus news. The reason for all the infirmary visits on campus has been discovered. The main cause is from a bacteria called Neisseria meningitidis, which causes meningitis. It also seems that all the infected patients came in contact with each other and have connections in some way. Now here's Dr. Professor Wyatt explaining the diagnosis of each patient.
Thanks, Doug. After running multiple DNA sequencing tests and ELISA tests, I concluded that there were 4 patients with matches of meningitis. The DNA sequencing test involves matching the infected DNA sequence of the patients with the DNA sequence stored in large databases to find identical matches of a bacteria or virus. By checking Sue Smith's DNA, I was able to see that she had meningitis along with Jill, Marco, and Maria. The symptoms of these people matched the symptoms that people face with meningitis. The running of an ELISA test on all 4 of the patient's antigens concluded that Sue was patient 0 because she had a higher antigen count.
So what exactly is an ELISA test and how does it work?
An ELISA test detects antibodies in your blood. It uses antibodies to target out specific antigens. When the antibody attaches to the antigen, a secondary antibody also attaches with an enzyme that changes color. The color change tells how far the disease has progressed.
Thanks, Dr. Professor Wyatt. Now to Trisha Takanawa, who is going to explain how meningitis spreads throughout these 4 students, starting with patient 0.
Let's see where this all started. Sue is patient 0 because the ELISA test showed that she had the most antibodies present in her blood. This means that the disease started with her. Sue then passed it off to her roommate Jill. Jill and Sue are in close contact with one another. Jill then passed it off to Maria because Maria is often at Sue and Jill's dorm and often drinks after Jill. Sue also passed it off to her lab partner, Marco, because they often share snacks with one another. Several other illnesses being spread around campus. One of the illnesses being spread around is the influenza B virus, also known as the common flu. This began when Anthony picked up the common flu and passed it off to his friend Arnie when they were picking out pictures to use for the local newspaper. The second illness being spread around is mono. This began when Wanda picked up mono from her boyfriend Ray. Wanda then passed it off to Alvin when she gave Alvin a coffee. The third illness being spread around campus is strep throat. The only student on campus known with strep throat is Maggie.
Bacterial infections are caused by bacteria. They are treated by using antibiotics. Antibiotics will kill bacteria but are ineffective against viral infections. Viral infections are caused by viruses. Viruses have cell membranes that are identical to the host and will not be targeted by antibodies. Now Disease Control Dan will explain how to prevent meningitis from spreading around campus.
People with meningitis will be hospitalized for 10 days to receive intravenous antibiotics to kill the infection. They will also receive corticosteroids to reduce the swelling of the neck and prevent further damage. Anyone who has come in contact with someone with meningitis should take either Cipro or Arifidin so you do not catch the disease. The campus should also inform their students how to prevent meningitis and the symptoms that come with it. Students should also avoid drinking after one another and eating after one another so they don't catch the disease because it is very contagious. Hand washing and sanitizing is a must.
Wow.